Chair recognizes the gentleman from Michigan, Mr. Upton.
Well, thank you, Mr. Chairman. Mr. Chairman, I made a pledge, written pledge not too long ago that said that I would read the bill before I ever got close to voting for it. I'm glad I didn't start reading this 1,000-page bill, because this next 1,000-page bill came out only today. I'm from Michigan, and our unemployment, as Mr. Dingell said, is 15.2% statewide, up from 14.1%. And I would guess that there are a good number of areas of Michigan that are even considerably higher than 15%. We're not in the best of economic times, and employers and their families are really struggling. The Lewin Group says that 2 out of 3 Americans are going to lose their health care coverage under this bill. 2 out of 3. I thought folks were guaranteed to keep their coverage. But I wonder how many of those 2 out of 3 are going to lose their coverage because they also are going to lose their job. My bet is that they'd rather have their job than get unemployment compensation, and as we've seen in Michigan, get those benefits exhausted, which 18,000 Michigan families will do this month, and next month, and next month, and the next month. 100,000 Michiganders are going to lose their unemployment benefits this year. They're exhausted. NFIB tells us that as many as 1.6 million jobs could be lost under this bill. And I would note that Christina Romer, the chair of the President's Council of Economic Advisors, apparently reported that we'll lose 4.7 million jobs. NFIB says that 55% of those jobs are with employers who employ less than 100 workers. And that is before we get to cap and trade. Now, I've heard from some of my employers, Goodwill Industries, who rely on charitable contributions. I have one with 230 employees, many of them part-time. They're glad to have a job. They do a wonderful job. They tell me that it's going to cost them as much as $765,000 under this bill. Something tells me that they're not going to have 230 employees if this bill passes. I have a lot of farmers, fruit and vegetable folks, people that work really, really hard, don't have a lot of program crops. We rely a lot on migrant labor. And many of those growers file their taxes with S corporations. The surtax isn't going to be real popular on the farm. Canada and the Brits, they're cited quite a bit. And frankly, they have a luxury because they can have many of their patients needing care come to the States. The Wall Street Journal reports that Ontario sent more than 160 patients to New York and Michigan for emergency neurosurgery. Well, if this bill passes, where are we going to send our people? I don't know the answer to that. This 1,000-page bill needs to be vetted thoroughly before we can send it to the floor. Now, I've been on this committee since 1991, and I do not remember a time that we skipped on a major bill like this in a previous year, the subcommittee of jurisdiction. We shouldn't have skipped that. We should have had the subcommittee vet this out. We should have had a better understanding to get this bill done. And I see that my time has expired. I yield back.
Thank you.